People recover from COVID-19. Not all of them get to go home right away.
And that is why Mary Free Bed is opening up a special unit just for those patients after they leave the hospital. Fox 17's Julie Dunmeyer joins us live tonight to explain. Julie?
Derek and Annie, it's affectionately called the recovery unit here at Mary Free Bed. It's got 18 private rooms and it's completely separated from the rest of the hospital. You actually have to go outside. You can't even get to this part of the hospital from the inside. And that's, of course, to keep everyone safe. This unit is meant for those people who have already had a long stay in the hospital and have an even longer road ahead to recovery.
We are basically providing these patients with whatever it is that keeps them from being able to go home.
A new unit at Mary Free Bed makes sure COVID-19 patients are on the safest possible path to recovery, says Mary Free Bed Chief Medical Officer Dr. Michael Jakubowski.
Because of some of the unique problems that we're seeing with COVID patients, these patients need to be able to try to get up again and walk 100 feet before they get exhausted.
CEO of Mary Free Bed, Kent Riddle, says this type of unit is incredibly important for Michigan.
Patients are coming to us in this unit from all over the state. One of the things that we look for when we're admitting patients from these other hospital systems is that they're actually starting to get better.
Dr. Jakubowski says COVID patients, as they recover, don't get better overnight. He says they get two different kinds of patients in the unit. One type of patient who could be admitted to the recovery unit is someone who basically needs time to have their lungs heal.
They bring a whole set of breathing issues, and those breathing issues often are a good set of lungs, a good organ systems that are fine. But despite the fact that they can breathe, they can't oxygenate.
And the second type of patient
would be patients who need us anyway, who have had a spinal cord injury or a stroke or a trauma of any kind, and in the course of life have picked up COVID somewhere, so that now they have the COVID virus on top of a problem that otherwise also needs rehabilitation.
Those who have been on ventilators for extended periods of time need time to heal and regain strength in their lungs. They also see patients with other complications from being sedated or in the hospital for long periods of time.
Some patients who have had COVID and have gone through the hospital and have been on a ventilator and such and are so deconditioned, so weakened, so unable to function, that they aren't able to go home safely.
But the goal is to get everyone home.
Was one hospital system that works with all hospital systems. We're really just bringing our expertise to this to really help in conjunction with them to help these patients. Now, that unit has been open for about a week. It's actually got 8 patients there, and doctors and nurses here at Mary Free Bed are, of course, following all of the CDC guidelines at regular hospitals, at other hospitals, non-rehabilitation hospitals, like social distancing, masks. The whole 9 yards is being done here as well to keep everyone safe again, with that goal of getting people back on the right track so that they can go home. For now, live in Grand Rapids, Julie Dunmeyer, Fox 17 News.
All right, Julie,